The term Back to the Future takes on another meaning when Dr. Roberts explains her exclusive anti-aging system. Maintaining a younger appearance is not magic, but a scientific system that helps her patients turn back the clock.
So if I said to you, how would you like to look 40 forever for the rest of your life? That's been my song that I have sung pretty much since 2011. When I saw that my patients were aging right in front of me. When I started seeing them, they were very vital and looked great, great skin, great hair, great body. But then time marched on, and I actually watched them age. Skin sallow, wrinkled, lack of shine, men losing hair, humped over. And I said, no, we've got to do something about that. And that's when I started on my quest, really for the fountain of youth, or what I say, back to the future. If we know that you're aging and we know where you're going, then as a scientist and as a doctor and as a dermatologist, and even a double board certified dermatologist, then I need to be able to use all the tools that I have to be able to keep you looking like 40. So with all of my education and training, I came up with this solution. When you see me as a new patient, you have a full body skin examination. I look at you head to toe, and I have a little list right then, and I start talking about, and I grade everything. Then after I clear the skin cancer part, now let's talk about your aging. And this is the aging plan.
Dr. Roberts outlines how each potential aging issue is treated.
I look at your hair. Is your hair great, or are you at risk for losing hair? If you're at risk for losing hair, we get right into it. I prescribe supplements. I might do some injectable platelet-rich plasma, maybe a laser device, and we're going to prevent you from losing your hair. You will not be bald when you're 60. Moving down to the face, if I see brown spots and wrinkles, I'm going to start you on cosmeceuticals, which are products for anti-aging. We'll also make a non-invasive plan versus you may not need the fillers and the Botox yet, but you do need some skin tightening. Your face needs some attention. The neck, the same thing. I assess your neck, look at what you need, and prescribe procedures for your neck. Hands are tricky. Hands age, especially out here in the sun belted with all the golfing, right? So we might want to start some peeling for your hands before the brown spots show. Best way to treat a leg vein is to, one, prevent the activities that's causing the leg veins, but also to treat it early so that vein does not have time to get tortuous and wrinkled and blue. So treating leg veins early is the best. The key is treating everything preventatively.
Family history can alert you to look out for problem areas.
Family is very important in the aging plan. So what I want you to do is take a look at your family members and you'll see what you might be at risk for.
Dr. Roberts shares a patient's story.
I have compassion for the aging, beautiful woman. One of my patients was a model, and in her 5th decade, she just started not looking like herself. And what we do with generational dermatology is get her back to her young, beautiful self. Had we known about this type of practice back in when she was in her 30s, we could have started then. But we were successful in bringing her back from her 5th decade back to something that she's really proud about.
Dr. Roberts emphasizes her approach, generational dermatology, which anticipates problems due to risk factors.
So my best advice is to take aging seriously. It's going to come to you. It's coming for you. I say, since you know it's coming for you, let's be prepared.
For an appointment, call Dr. Roberts at 760-346-4262.